I'm back once again, and I'm Carmela Salvador-Alapag, a public school teacher, and so happy to be here once again here at CSA. And I'm back for another enhancement of beauty. So 2 months ago, I was here at CSA, and Doc Tessa actually had some treatment on me under my eye and something here, over here on this side, everything on the center of my face. And actually during the process, right after the process, my colleagues and some of my friends noticed something different about me. They were looking at me and then trying to figure out what happened, and just to find out after telling them that I had treatment here at CSA. And I'm so happy once again to be back here. Although so much stress at school, but every time I'm here at CSA, it really is a stress-free, because I believe once again, I'm expecting for an enhancement again, and I believe I'll be undergoing improvement on something to do with skin quality. So don't forget to subscribe and click the notification button so you'll be updated of the latest trends here at CSA Medical Aesthetics.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up of Ma'am Carmela Alavazo. Hello.
Hello po.
So 11 weeks ago, we did multiple procedures, combination of fillers and threads. We worked on the forehead area where we wanted to restore the forehead projection, plus also improve, of course, the volume loss in the inferior part of the forehead. We use the threads and the filler. And then on the middle part of the face, we also work on the nose. We use those nose PDO threads. And also under eye area, remember, we did combination of hyaluronic filler plus those PDO mesh threads or braided threads. And then we worked on the nasolabial folds. We use the combination filler and threads. Then also the lips, okay, we had the hyaluronic filler injection, plus on the chin, also filler injection. So far, Ma'am Carmela, how was it?
Very awesome. Amazing.
Amazing, right?
Opo.
A lot of people notice
Yes po.
changes?
Yes po.
Okay. So what was the common comment of the people?
Ma'am, parang may nagbago sa'yo. Parang something new. Ganun.
Oh, and they cannot pinpoint
No.
what is the specific
Yes.
change on your face, right?
Opo.
So we did combination of those procedures to rejuvenate and of course reverse the aging process. As you can recall 3 Ds of aging: the descent, the deflation, and degeneration or deterioration. So we want to reverse those. We want to replenish what was lost, like your collagen and your elastin. We also want to refresh, and we also want to regenerate, making use of those natural substances like your hyaluronic, plus also the polymer PDO threads to stimulate newer collagen. Today, we've mentioned during that episode that we will also do a treatment called Fox Eye Thread, right? To lift this corner of the eye, because we notice you're having hooded eyes. Yan, beginning droopiness on the upper eyelid, even the eyebrow, not only the upper eyelids, but also the eyebrow area, okay? Bumabagsak na. It's descending. So we want to kind of lift that part there. Plus, we want to improve also the quality of the skin, okay? Nowadays, like a lot of people are talking about this glass skin, radiant skin, porcelain skin, flawless skin. So we want to improve this skin envelope. We want to restore the radiance. We want to restore that very good quality of your skin condition. Okay? So I think that's another thing that we want to watch out. And what kind of treatment, what kind of procedures are we going to do for Ma'am Carmela today? We'll show you when CSA Medical Aesthetics return. And we're back. So we're doing the so-called fox eye thread lift for Ma'am Carmela. So we're working on the corner of the eye here. Okay, the goal is to reposition this saggy upper eyelid in the eyebrow section there. I'm gonna start with injecting with my lidocaine. Okay, you can do actually a nerve block for this one, like your supraorbital nerve block here. You can just inject like a 0.5 to 1 ml of your lidocaine. Okay, so for this part here, my entry point will be on the side of the eye area, the corner of the eye. Okay, so just make a local infiltration here. So a while ago we applied numbing cream. We left it for about like less than an hour, or can leave it for 30 minutes. Okay, then we'll just do tail of the brow there. We just do lidocaine injections here. Okay, and then we're just gonna use our PDO double cog thread to lift this part. So like the previous procedure we did for Ma'am Carmela, we did the brow cog thread lift basically on the middle part of the forehead region, the entire forehead. So lifting there. Okay, you can start with our first one here. So make a prick of your entry point, and I have a double cog PDO thread here, and I'm just gonna glide. So like as to the anatomical layer here, this part here, if you want it really very strong, you can actually insert it into that interfascia plane. I am on my second cog thread here. Okay, so I'll insert into this entry point here. I'm using a double cog again, and this is just to glide in your, you can like use the interfascia plane here. So it's kind of anchoring your cog into that in between your fascia layers, your superficial temporal fascia and your deep temporal fascia there. Okay, so a third one, which is gonna be my final one there, you can actually like lift the arch of the brow here to open up the eye area. Okay, now last time we did also under eye filler plus the so-called PDO mesh threads in the tear trough area. I want to add the so-called Derma spring PDO under eye threads to just reinforce what I did last time. So this is for the right side. Okay, so when you cut the remaining strands here, you want to pull it up like this. So this is a reverse method, cutting like this. Okay, there we go. Then we just want to reinforce what we've done in the past treatment. Okay, so this one is injecting a lidocaine again at the entry point. Then I'm just going to use my Derma spring thread. Okay. So I'll just be one by one inserting Derma spring type of PDO thread. It's like arranged in a spring or like a coiled pattern there. Then we're just going to glide this in the subdermis layer or your subcutaneous part. You want to stimulate fibroblast cells, so you want to place it in the layer where you have your fibroblast cells. Okay, just glide it there. Actually, there's already a big improvement of the under eye. So the pigmentation was decreased and the lines were already reduced. So a big improvement. Like how many % of improvement, Ma'am Carmela, you think? Of the under eye area? I don't see any more lines here. A big %, right? She can't talk because she's feeling the pressure from the thread. Okay. So this one is a fanning method here. Okay. Now on the physician's point of view, the improvement I could say is already like 80% because it's been 11 weeks actually. Usually on the 4th week, you have collagen formation. 8th week to 12th week, you already have the collagen type 1 there. You've developed those dense collagen in your skin tissue layer. And I think this is the final one. Okay. So I noticed also like the upper eyelid is kind of weak. So we want to reinforce it with some of my very short PDO thread here, like this one. We call this an inch thread here. Okay, inch thread. You can use those, like for example, 10 millimeter type of thread. If you have your 20 millimeter, 30 millimeter, you can use it also in this area. Like this is just to help this skin here to regenerate with collagen. Okay, so we've done the right side. I'll continue with the so-called Eladerm. The Eladerm is a device that makes use of your radiofrequency with microneedling. So Eladerm can help in improvement of the skin quality, the skin condition. Like if you have pigmentation, especially Ma'am Carmela has beginning melasma in the mid-face area, okay, or poor skin tone, okay, or open pores. And also if the quality of skin is really not good, it's a dry skin, plus, you know, some presence of the comedones there. Also what you assess is the elasticity. Actually, she already has good skin elasticity, okay? So I'm pinching on her skin. Because a year ago, before we did the Sculptra, we were doing the pinching like that. So remember, Ma'am Carmela, we did a pinching and there was really skin laxity, and right now it's really tight. Wow, amazing. So we're just improving the outer area, the outer layer, the so-called the skin envelope, the layer 1. So we have again our Eladerm. Okay, so this is an RFMN with a cryo spray. Okay, so we can start with our treatment. So we're using, there are the two types of tips that we have. We have the cryo tip and we have the vacuum tip. So I'll start working on the right side of the forehead here. Okay. There you go. You heard the spray. That is the cryo spray. Okay. So on the forehead region, you can actually deliver the radiofrequency energy. So right now we're using the 1 millimeter depth, and Ma'am Carmela has some scars on the forehead area. You're good, Ma'am Carmela? Okay. So cryo spray helps in reduction of any discomfort or sensation of your micropins there. Okay. So we're doing the right side of the face, okay? Then I'll be also finalizing the treatment of Ma'am Carmela with the so-called injection of micro Botox, okay? So we want to treat also her crow's feet. When she smiles, she has these wrinkles on the sides of the eyes. Right, Ma'am Carmela? Yes. So we'll treat that also. Now, the Eladerm is always combined with the so-called skin booster. We have the Plabiome skin booster. So they contain some amino acids, peptides, vitamins, and minerals to help in the fast repair or healing of the skin tissues. Plus, of course, this type of skin boosters will also help improve the quality of the skin. So we want an even skin tone, we want that good color homogeneity, and good skin quality there. Okay. So we'll just move on with the left side of the face. Done with the Eladerm, let's proceed to the other side. So we have done the Eladerm, of course the fox eye threads plus under eye derma spring threads. We'll add Botox injections on the crow's feet and the glabella area. Disinfect these. Okay. So I'll start with the left crow feet here. You'll just stretch the skin and you're gonna inject it like intradermally. You want to relax the orbicularis oculi muscle, the lateral part. Then let's do the right area here. Okay. So usually with Botox, you see the result in 2 weeks' time. The onset of action is around day 3 for this kind of brand. Okay, so we want to get rid of this vertical lines of Ma'am Carmela. Okay, so we've done again multiple procedures for Ma'am Carmela. We'll show the result when CSA Medical Aesthetics returns. And we're back. Let's show the result of Ma'am Carmela. Carmela, here's the mirror. There you go. So we did a combination, your Fox Eye Thread Lift together with those Derma Spring under eye and a little bit of those inch threads on the upper eyelid, plus also our Eladerm. And with the Eladerm, we also use the so-called Plubiome Skin Booster, which has a lot of these amino acids, peptides, vitamins, minerals to regenerate the skin and also refresh the skin, and it's gonna improve the skin quality. How are you, Ma'am Carmela? Right.
So happy po.
To see the difference. There's an instant result, especially the eyebrow. Her eyebrows actually, before the treatment, they were droopy. Or I could say it's a straight eyebrow, right? Flat, straight, and lowered eyebrow. But right now we were able to lift it to kind of, you know, somehow feminize the eyebrow because we want the high arched eyebrow for women. So like there are different eyebrow shapes right now. There's this high arch, there's this straight, there's this flat, or there's this kind of like they call it angry bird, something like that. Okay, but so far so good, right?
Opo.
And we also did the injection of botulinum toxin to relax the muscles on the sides of the eyes, plus also the glabella complex there to improve, to kind of treat the glabellar wrinkles plus the crow's feet. How was the experience, Ma'am Carmela?
Very fulfilling po. Thank you, Doc.
Oh, you're welcome. Okay. I hope that this is like, you know, helping you with your, like, your career, being a teacher. So she's in the education industry. There you go. You're teaching high school or?
High school.
Oh my goodness. It's not an easy career, okay? And, you know, with that kind of career, it accelerates the aging, right?
Exactly po.
Okay. So makes you look older than your actual age. So with this treatment, it will help you kind of, you know, restore the young face, the young skin that you had before. Okay. And plus an acne there, okay. The good thing is with the radiofrequency microneedling, it can also treat those active lesions. So no problem on that one, okay. Thank you so much, Ma'am Carmela. So we'll check more.
Din po, Doc.
Yeah, we'll follow you up. We'll see the improvement, especially from the Eladerm, how the quality of the skin will be improved, plus those skin boosters. Actually, right now, we're doing a lot of skin booster infusion together with our microneedling because these boosters, they have skin micronutrients. Our skin will need them. It's like feeding your skin, and it's gonna, you know, restore that youthful look, that radiance of the skin. Plus, you know, you help the skin cells to maintain their you know, their function and their structure. Okay, plus improve that superficial skin layer because a lot of people right now they want to really have this just refreshed skin, and a lot of women are not into putting makeup, right? So they just want to bare their skin. So treat your skin with your skin boosters to kind of give you that glass skin, that radiant skin. There you go. Ma'am Carmela, any message sa audience?
Yes. First, I would like to thank CSA and kay Doc Tessa considering our job. Sometimes because we're so busy, there is not much time to wear makeup. So this one will help actually. And actually, there is an instant result. Very, very good.
Yeah, I can see all the results from the previous treatments that we've done. Imagine, we started with the Sculptra. I was doing the pinching. Wala na yung loose skin. It was so loose a year ago and a lot of volume loss there. Right now, there's volume and plumpness. Okay. Tapos, we combined also yung mga, yan, sa nose, sa under eye, sa lips, sa chin, sa forehead, and it really gave that big improvement on your face. But still looking natural, okay? You're just beautiful in your age. Okay, yan. Yun ang goal lagi. So, they can follow you at?
My Facebook account, Carmela Salvador-Alapag. You can message me. Actually, may mga nagme-message. Sorry, pwede ako nakaka-reply.
Yeah, just forward them at our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. You can email us at csaskinclinic@yahoo.com. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please watch the other videos. So, Ma'am Carmela's previous episode, so you can check how she looks like before a year ago and compare the before and the after. Okay, thank you so much. Okay, God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.